Hi everybody, it's Noel O'Neill from the Ayurveda Centre. So I'm just here today with Dr. Chitelli. We're just going to talk little bit about her work and what she does in Ayurveda. So Dr. Chitelli, you're very welcome along to this little webinar that we have. So can you tell us, when I say Dr. Chitelli, what I mean by that is an Ayurvedic doctor, and in India an Ayurvedic doctor would be called a Vaidya. But can you just tell me a little bit about the education that you did in order to become a Vaidya?
Yeah, so I hold a BMS degree, which is like Bachelor's of Ayurvedic Medicine and Surgery, from a renowned Maharashtra University of Health Sciences in India, which is a 6 year full-time medical degree that gives in-depth training about Ayurvedic medicines, the anatomy, physiology of a human body, and then Panchakarma therapies, yoga, and then holistic nutrition as well.
Okay, and then what happened that so that was your 6 year degree. So you covered a lot of the things that maybe an allopathic doctor would cover as well, like anatomy and physiology and all those things. But then obviously you're looking at disease from an Ayurvedic point of view. So after your education, then did you go work in hospitals or in clinical setting?
Yeah. So for few years, I worked as a clinical research associate in one of the renowned institute in India, which is National AIDS Research Institute. And later, then I started my own practice. I had a own clinic in India called Arogyam. And then I moved to Singapore and I worked with the reputed institutes there like Om Vedic Heritage Center and Ayurveda Pharmacy in Singapore. So totally, I have around like 11 years of clinical experience practicing Ayurveda, yoga, and Panchakarma here in India, Singapore, and now in Dublin.
Okay, and when did you move to Dublin?
I moved to Dublin like 4 years ago in 2021.
Okay, okay, and you're now practice from Dundrum, isn't it?
Yes, Dundrum.
Yeah. Okay. So what sort of conditions are, what sort of things are people coming to you with? I mean, I know Ayurveda is primarily, a prevention orientated system of healthcare, but unfortunately in the world we live in today, a lot of people don't start looking after their health until something has gone wrong. So, what kind of conditions what are the general type of things people would be coming to you with?
Yeah, so I see a wide variety of patients from like busy professionals and the students to mothers, young adults, kids, and seniors. So, who are looking for natural and side effect free ways to manage their health. So, some common disorders which I treat is like the digestive issues like IBS, chronic constipation, indigestion, hemorrhoids, skin conditions like eczema, psoriasis, acne, women health concerns like PCOS, irregular menstrual cycles, or hormonal imbalances, menopause, stress, anxiety, insomnia. So, the common alignments of arthritis and allergies, sinusitis, and even weight management. So many individuals also come for like seasonal detox and rejuvenation therapy, like panchakarma, for the seasonal detox of their body. And usually this is really important here in Ireland. What I feel is like where the weather changes can affect the digestion, the skin, and overall energy of any individual.
Okay, so it sounds to me, I mean, pretty much you're dealing with the whole range of issues that people go to their normal allopathic doctor with as well. But Ayurveda is dealing with things, I mean, we won't go into it too much, but just give us a general, what would the type of prescriptions that you'd be given to people? I mean, I know Ayurveda is very much based around lifestyle and diet, but let's say someone came to you with the IBS, let's say, generally, just roughly, I know every individual is different, but what sort of information would they be going away with?
Yeah. So the first thing is like the first consultation, which usually lasts for an hour. So I take a detailed look at the history of the patient, not just with their symptoms, but also with the diet, the sleep, the digestion, the stress levels, and the lifestyle habits which they are undergoing. And I assess their body type, know their doshas, and even the imbalances which are happening into the body. And during the consultation, I do explain the basics of Ayurveda fundamentals to better understand like how their need of body is. And it's a personalized, and at the end, like I create a detailed personalized treatment plan that includes diet and lifestyle guidance, herbal remedies, any yoga or breathing techniques or pranayamas and meditations which are needed for that individual, and sometimes detox therapies if it is needed. So this is how it consists of.
Okay. Okay. So it's a very comprehensive thing, really. I mean, an hour-long consultation, so you get to cover quite a lot of ground. And I'm sure the patient goes away armed with a lot of information and maybe a lot of changes that they need to make in their life as well. Because I
Yes,
suppose the ultimate responsibility for your health lies with yourself, and maybe a doctor can just guide you to do the right things, you know? So
correct.
actually, you
And
mentioned,
one more
sorry.
thing I would like to add in, like when they come for the follow-up sessions, it helps to track the process and or the progress of that patient and make adjustment in any herbal needs if required. And it's really a very holistic and a supportive process, I would say, designed to just restore their balance in their body
Okay,
gently.
so I'm just going to share my screen here for a minute. I want to let people know where they can get more information. So you can see our website is here. It's ayurveda.ie. And you can see that Dr. Chitali's information is there just on the right hand side. You can see her phone number and probably more importantly, her email address. So maybe the best way to get in touch with her is by email. Now, Dr. Chitali does online consultations. That suits a lot of people these days. They don't have to travel so far, or they don't want to travel. But certainly, she also does personal consultations in Dundrum as well. So you can contact her directly there. We have this fantastic 7 lesson course. If you'd like to find out more about Ayurveda, you can just click on that link there. And this 7 lesson course, actually, when we designed this course, Dr. Chichali wasn't with us, but some of our other Vajajas are there. But there is one great webinar that she does as well. I'll show you how to get that in a minute. And you can register for that course. You can read all about it there. It explains all about Ayurveda. And there's some testimonials from some doctors and from other people are there as well. Also on our website, we've lots of free webinars on different conditions. You can see them there: arthritis, anxiety, psoriasis, sinusitis, tinnitus. So lots of different webinars. Dr. Chitali has done many of them. That gut health webinar springs to mind. It was a very powerful webinar that Dr. Chitali did. So you can just register for any of those webinars. They're all free of charge, and we'll send you a copy of them. So another thing that Dr. Chitali does is she also travels to the UK. I believe you're going to Bristol fairly soon as well. So we have a lot of customers in the UK. All of our doctors really travel to the UK. So we have a UK website which is ruland.co.uk. And again, you can get all our contact details there as well and find out. It's very similar to the Irish website. So ayurveda.ie for Ireland and ruland.co.uk for the UK. And as I say, Dr. Chatelli does travel to the UK, but even if she doesn't directly go to your area, you can always do a Zoom consultation as well. So that's it, Dr. Stratelli. Thanks very much for coming on and sharing that with us. And if anyone wants to get in touch with you, they have all your contact details in order to do that.
Just, uh,
Thank
just,
you.
just to
Yep.
end, I would say like I truly believe like Ayurveda is not just a treatment; it's a way of living in harmony with yourself naturally. So stay in balance and get well naturally.
Okay, that's perfect. That's what I believe myself. Health and happiness go hand in hand, and it's
Yeah.
all about living the right way and preventing disease in the first place. Okay, thank you very much.